There is more hope than previously with patients with chronic rhinosinusitis with nasal polyposis. Partly because we're beginning to understand more about it with good quality research, and partly because we have these new therapies, the biologics against various cytokines and against a possible initiating molecule, TSLP, which currently being used mainly in severe asthma, but also work in many patients because the pathology of the two diseases is type 2 eosinophilic inflammation. And so with this, patients who have both polyps and asthma and are sufficiently severe are being treated with these expensive drugs, and their lives are being revolutionized, absolutely improved beyond measure almost. So now what we need to do is work on the patients who haven't had the biologics, try and get their lives as good as they can possibly be by the other medications which we have, and by the use of very simple measures like nasal douching. This disease appears to happen because of influences on the epithelium, the lining mucosa of the nose, and simply washing out the nose can actually make a difference, especially if done regularly. It's horrible at first, but once patients realize how much better they feel afterwards, they are likely to carry on doing it. And it also means that they then have better access for the usual second therapy, which is topical nasal corticosteroids, often in drop formulation and sometimes as a nasal spray. Policymakers need to first of all recognize it, the fact that it exists, and then to recognize the fact of how severely disruptive it can be to life. Once policymakers realize that, the long-term implications, the implications for work and productivity, then I think they might give their blessing to allowing the expensive new molecules to be used not only for asthma, but for nasal polyposis in its own right. Here in Belgium, that already does happen with some drugs. In the UK, we do not have any monoclonal license for chronic rhinosinusitis with nasal polyps as yet. And EUFOREA is also trying to join with the WHO as part of its aims to improve patient awareness not only in Europe, but worldwide, because this is a global problem.